Therapy sessions are expensive and time-consuming. More importantly, if you have a bad experience with psychotherapy, you might avoid it for the rest of your life. That's why we decided to make this video, to help you find the best therapy for you. We briefly introduced the 4 main approaches in psychotherapy by focusing on specific problems and personal preferences to help you make an informed choice. Let's start by exploring the oldest form of psychotherapy: psychoanalysis and psychodynamic therapy. This form of therapy emphasizes exploring unconscious thoughts, feelings, and behaviors to gain insight and resolve psychological issues. The point is to make you more self-aware and help you to understand the influence of your past experience on your current behavior. This form of therapy is particularly beneficial if you have one of these issues or preferences. Difficulty with interpersonal relationships. Psychodynamic therapy can be helpful for individuals who struggle with forming and maintaining healthy relationships. By exploring early attachment experiences and patterns of relationships, clients can gain insight into how they interact with others and learn new ways of relating. Trauma or unresolved past experiences. Traumatic events, such as abuse or neglect, can have long-lasting effects on a person's psychological well-being. Psychodynamic therapy can help individuals process and heal from these experiences by exploring how they impact their thoughts, feelings, and behaviors. A willingness to engage in self-reflection for personal growth. Psychodynamic therapy can be beneficial for individuals who are interested in self-exploration and personal growth. By examining unconscious patterns and exploring new ways of thinking, individuals can gain a deeper understanding of themselves and improve their overall well-being. This increased self-awareness can lead to greater emotional intelligence and more effective coping strategies. Psychodynamic therapy requires many therapy sessions and a great amount of commitment to the process. If you are someone that likes to dive deep into their thoughts and explore their inner world, you may benefit greatly from this approach. Behavior therapy. While psychodynamic therapy focuses on exploring the unconscious mind and unresolved past conflicts, behavior therapy focuses on changing maladaptive behaviors and developing new coping skills. Behavior therapists try to modify negative or unwanted behaviors by replacing them with more positive and desirable ones. Some examples of people who may benefit from behavior therapy include individuals with anxiety disorders and phobia. If you are struggling with any form of phobia or anxiety, behavior therapy is perhaps the best choice for you. In this approach, the therapist helps you learn how to manage your anxiety by teaching relaxation techniques, cognitive restructuring, and exposure therapy. It also helps individuals overcome their fears by gradually exposing them to the source of their phobia in a safe and controlled environment. Individuals with depression and obsessive-compulsive disorder. Behavior therapy can help individuals develop more positive and healthy behaviors that can improve their mood and overall well-being. It also helps individuals with obsessive-compulsive disorder learn how to control their compulsions and manage their obsessive thoughts. People with behavioral problems. Behavior therapy can be particularly effective for children who have behavioral problems such as ADHD or oppositional defiant disorder. It has also shown promising results in helping people with autism disorder by breaking down complex skills into smaller, more manageable steps, and using positive reinforcement to encourage the development of these skills. Overall, behavior therapy can help individuals learn more positive behaviors and improve their relationships with others. If you prefer a more structured form of therapy, then behavior therapy is the right choice for you. The next approach is called cognitive therapy. Cognitive therapy focuses on what people think, rather than what they do. Cognitive therapists believe that it is dysfunctional thinking that leads to dysfunctional emotions or behaviors. They help individuals identify and challenge their negative thoughts and beliefs that may be contributing to their distress. Cognitive therapy has proven useful in treating a wide range of disorders like depression, anxiety, obsessive-compulsive disorder, post-traumatic stress disorder, eating disorder, and so on. But it can also help you with identifying negative thought patterns. Cognitive therapy helps individuals identify their negative thought patterns and understand how these patterns contribute to their distress. By recognizing and challenging these thoughts, individuals can develop more balanced and realistic ways of thinking. Developing problem-solving skills. By learning how to approach problems in a systematic and rational way, individuals can feel more confident in their ability to handle challenging situations. They can develop problem-solving skills that can be applied to a variety of situations. Improving mood. Cognitive therapy has been shown to be effective in treating depression and other mood disorders. By finding negative thought patterns and dysfunctional beliefs, individuals can experience improved mood and greater emotional stability. Cognitive therapists usually use specific assignments to make the most of the therapy sessions. So you have to be active during the process. In turn, you can develop skills that can help you throughout your life. If you think you usually engage in negative self-talk, have a tendency to overgeneralize ideas, and struggle with distorted thinking patterns, cognitive therapy is the best choice for you. Humanistic therapy. Humanistic approach emphasizes personal growth and self-awareness, with the belief that individuals have the potential for self-healing and personal growth. It may be beneficial for individuals who are seeking a non-judgmental and empathic approach to therapy, and who want to focus on their individual strengths and potential. Humanistic therapy is particularly helpful in these situations. Individuals who are struggling with issues related to self-esteem, personal growth, and self-acceptance. It can also be helpful for those who want to explore their emotions and thoughts in a safe and supportive environment, without feeling pressured or judged. People who want to improve their communication and interpersonal skills, particularly in their relationships with family members, partners, friends, or colleagues. Individuals who are going through a major life transition, such as a divorce, career change, or loss of a loved one, and need support in coping with the emotional impact of these changes. Humanistic therapy may not be the most appropriate treatment for individuals who have severe mental health conditions. But overall, humanistic therapy is suitable for those who want to focus on their unique experiences and perspectives, and explore their inner selves in a supportive environment. Here we explain the 4 main approaches of psychotherapy, but you should know that nowadays many therapists use an integrative approach and combine these methods to get better results. But if you find a specific approach more interesting, you can do some research about the approaches of different available therapists and decide based on your preferences.